I'm Dr. Soumya Basanth, working as a cornea consultant at Zamandar's Microsurgical Eye Center for the past 7 years. My main area of interest is cornea and its diseases. It's a microtrauma caused by chronic irritation. One of the etiology or the causative factors are when there's a chronic UV exposure, some light gets reflected off from the nasal side onto the medial part of the eye. So that is when you have chronic irritation and causing this extra fold of growth onto the corneal surface. Or it can be sometimes, it can be very violent. You can have both sides, it's called a double-headed pterygium from the nasal side as well as the temporal side. And how do we manage? These patients can present to us with chronic redness, irritation, on exposure to outdoor wind or sunlight causes chronic irritation, redness, some foreign body or discomfort, or some people don't have any symptoms at all. Whenever there's a fleshy, thick growth, when they come up with, positive symptoms, that is when we treat them. Otherwise, it can be left alone also. First is medical line of management. We try so that we give palliative treatment like antihistamines and lubricants so that, their symptoms are alleviated. When that is not, sufficient, that's when we go in for the surgical options, that is pterygium excision. What we do is excise the pterygium. To prevent the regrowth, what we do is we do an autograft. It is called conjunctival-limbal autograft or CLAG, where the graft is harvested from the same side of the eye in a different position of the eye, or it can be harvested from the contralateral eye. This is the autograft because it's taken from the patient itself. How it is secured? The pterygium is excised and the bare sclera part is covered by the graft. Graft is harvested and then it is secured either through fine 10-0 sutures. They are very fine microscopic sutures which are sutured to anchor the graft in place, or we use a tissue glue called as fibrin glue. It's a bio glue which can seal this pterygium to the underlying bare sclera. The post-operative period with the sutures can cause some kinds of irritation or redness because the sutures are exposed. Though we do a buried knot technique, it can cause some kind of a discomfort to the patient. So lately when we are using the fibrin glue, this discomfort is also, the patient does not have these symptoms also. Over a period of 1.5 months, post-operative drops are given and finally the patient recovers and there's no recurrence of the pterygium. By and large, even then sometimes we do have recurrences even with the limbal autograft. That is when we use another drug called mitomycin to prevent the secondary recurrences also. Thank you.